Minnesota is now the latest state to legalize recreational cannabis. The state's governor signed a law allowing residents over 21 to use marijuana, and that marks 23 states plus Washington, D.C. that have now legalized recreational cannabis, with more likely to follow. So let's take this to our group chat with ABC's business reporter Alexis Christoforous, ABC's Jay O'Brien in D.C., and ABC News medical contributor, physician at Stanford Children's Health, Dr. Alok Patel. Thank you all for being on. Jay, I want to start with you because New York has actually had issues with illicit marijuana sales despite its recent legalization. Can you explain what's going on with that and how this is expected to work in Minnesota?
Well, and it's interesting because as you just talked about that map of the 23 states, while New York has had that issue, different states are instituting different kinds of legislative fixes to try to get by that. Minnesota is still trying to develop its cannabis legalization process because they've got a state office that they've got to set up that will license medical marijuana, license legalized marijuana distribution and things of that nature. But when you look at that map, one of the things you see is a patchwork. Different states with different laws doing different things. And while New York may have some problems, Minnesota might try to fix that. On the federal level, they're trying to figure out how to normalize this, how to get a system across 50 states. While you can get a bill through Congress that would do that, and there's a lot of bipartisan support for that, we haven't seen any of those bills go terribly far. What we are seeing is the federal government look at reschedulizing marijuana. Right now, marijuana is a Schedule I narcotic, the same as heroin. They're looking at potentially revisiting that scheduling. That is an order from the president to do that. They're hoping, the HHS is, to get it done by the end of this calendar year, but right now we haven't seen if that's going to be actually happen by that time frame.
Now, Alexis, New York legalized recreational cannabis in March of 2021. The first recreational dispensary just shared that they made more than $12 million in just 6 months. So as more states legalize marijuana, how do you think it's going to impact the economy?
There's a lot of money at stake here, right? And the marijuana industry is having a larger and broader impact on the overall economy. It's estimated that the marijuana industry can pump $100 billion into the overall economy this year. That would be about 12% more than last year. And there are direct and indirect ways this is happening. First, the jobs it creates locally. It puts people to work, then they go back out into the economy and inject money into the economy. Also, it affects the real estate market locally because you've got dispensaries opening up, manufacturers, agricultural businesses, retail stores putting roots down in those areas. And then, of course, lastly, and very importantly, consumers and businesses are paying hundreds of millions of dollars in taxes. So this is another huge revenue generator for municipalities and states.
And Dr. Patel, I hate to ruin people's fun, but we do have to talk about the health aspects of all of this. Are there pros and cons here from a health standpoint? Walk us through this.
Well, that's what I showed for, is to basically ruin fun. But you know what? That's part of the job. So there are some concerns. And I don't think it should surprise anyone to know that there are studies that have shown increased consumption of cannabis-related products over the years as it's been more legalized in particular states. In fact, just recently, the CDC put out a report showing that in kids aged 0 to 14, cannabis-related emergency visits have actually gone up over the past 3 years in comparison to before 2019. So this is definitely something we should pay attention to, as there are a lot of unknowns about the long-term risk of any cannabis exposure to those developing brains. There are known issues in pregnant women and even older people, or people who may think that they are seasoned marijuana consumers, can also have adverse effects. And Diane, one big concern that I hear from a lot of people who work in this sector, both on the marijuana side and as it relates to public health, is that policy changes seem to be happening faster than scientific research. Now, potentially rescheduling this from a class one substance can actually help with that research process, but there's a lot more we need to know when we can actually put down strong labels about long-term use, efficacy for certain medical indications, and safety risks.
Jay, where does marijuana legislation stand on the federal level? You talked about efforts by the White House. Is there an appetite for this in Congress?
There is a bipartisan appetite to tackle this in Congress in some form or another, but we always talk about these issues in Congress that have bipartisan support, and they just can't get the oxygen that they need to really catch fire and continue on and become legislation. So we haven't seen marijuana legislation really capture that in Congress. We are seeing, as we saw that map earlier, the states really take the lead on this. A state like Florida could see marijuana legalization legislation on the ballot, potentially its next election. Ohio's looking at doing the same thing. And the polling really supports that voters are behind that. 88% support either legalization for recreational and medical use or just medical use.
Now, Alexa, several states are growing more cannabis than they can sell because there aren't enough legal retailers in the market. What's the impact of that?
It's a huge impact, and it's hard to believe, but the illegal marijuana trade is actually stronger and outpacing legal sales in states where it is legal. I'll give you an example. So California has had legal marijuana now for 7 years. Unlicensed marijuana sales were more than double licensed marijuana sales. And I think, you know, both Dr. Patel and Jay sort of alluded to this, is that policy is not keeping up with or the rules are not keeping up with the policy. And a lot of dispensaries just can't get the licenses fast enough. Taxes are also burdensome. And so they're moving into the illegal market.
Interesting. Dr. Patel, what do you think people need to know and what do they need to consider before using cannabis?
People need to really understand what they're consuming or what they're taking. I once took care of a child with a cannabis overdose. An emergency medicine doctor and toxicologist said, this is not your grandpa's marijuana. Over the years, the concentration of THC in certain products has increased. The amount of cannabinoids or active compounds, that's numerous. It's over 100. Most people just know about THC and CBD. And all natural does not mean safe. There are only 3 FDA-approved cannabis-related or derived medical products out there. So people really need to understand that there is a wide spectrum of available goods, and just to do your research and stay safe.
All right, Alexis Christoforous, Jay O'Brien, medical contributor, Dr. Alok Patel, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.